Hey, welcome back to Outpost 95. Today we're going to continue on our tactical medicine series and going over airway. Airway is the second thing in our MARCH algorithm. MARCH being massive bleeding, airway, respirations, circulation, hypothermia, and head injuries. Airway's been identified as the second um, leading cause of preventable combat deaths, and a lot of that has to do with the tongue falling back and closing off the airway if somebody loses consciousness, depending on how they fall. There's a lot of things that we can do on the layman level that are extremely effective in preventing this from happening. One of the simple things you can do to rule this out as something you have to worry about is going in and see if you can talk to them. If they can talk back to you, then their airway is open and you don't have to worry about that. They can talk back to you and their skin looks pink, warm, and dry, like the coloration of them is normal, then you're good to go, at least on that aspect of it right now. If their skin is starting to change color, look ashen and gray, like blood's draining out of them, that's something to worry about. All the oxygen's depleted from their body. If they can't talk to you, then you need to be considering airway pretty quickly on your priorities, because if they run out of oxygen for more than a couple minutes, they're going to cause brain damage and then ultimately death. One of the simple things you can do is lay them on their sides, put the head on the arm, and then position the other arm on the ground and the knee on the ground so that they won't fall forward, and everything that could come up, any blood, mucus, vomit, will drain straight out and they don't have to worry about losing an airway. Left lateral recumbent position, or for you Marines and college kids, a drunk buddy position. Works extremely well. Some other things we can look at doing. Most IFAKs, individual first aid kits, will contain a nasopharyngeal airway. Super easy to use, effective piece of equipment that can be put in anyone at any time, as long as there's no trauma to the bone structures of the upper sinus cavity leading to the brain. If you're just going to take one of these, measure it from the nose to the angle of the jaw, anything that's extra is going to be sticking out. You'll notice that they'll start to have a gag reflex if you put one of these things too far down. It's going to go on the right side, or it's designed to go on the right side. It can't go on the left side if there's trauma to the right nostril, or if the left nostril is significantly bigger. There's a bevel. The bevel is going to go towards the septum, or which is the middle part of the nose. If you put it on the left side, it's going to go in upside down, but the bevel is going to be pointing towards the septum still. It's going to go straight back, and then it's going to come back, and it's going to prevent that tongue from falling on top of the back of the throat and closing up the airway. If you're losing consciousness and I've got to carry you out, super effective piece of equipment to carry. I recommend that for anybody who's going to be carried out that's dealing with a altered level of consciousness. They used to teach, or maybe they still do, who knows, but when I was going through hospital core school and field med, they taught the oral pharyngeal airway, and these you'd use on an unconscious person, but that's going to go inside the mouth, preventing the tongue from falling back as well. If you're carrying somebody that's not on a strap to a backboard, and you put one of these things in, they've actually caused complications because these things will get lodged in funny. So don't ever use one of these unless you've got a spine board to accompany it. That's going to get inserted upside down up into the soft palate or the top of the mouth, and then rotated 180 degrees, and then it'll lodge in place. Theoretically, you should have this up against your teeth, but for the most part, you're not going to use this thing unless you've been taught how to use it and you've got all the other tools that go with it. Not practical for putting it in an IFAK. Other stuff to consider, if they got a bunch of mucus, snot, blood, vomit, whatever. I carry in my bigger pack a suction device, looks like a turkey baster. Go in the back of the throat, suck all that stuff out. Better than sticking your booger pickers in there and digging everything out. Depending on the scenario I'm in, And CPR, not recommended in a combat setting because it's not sustainable, and it's usually the lack of breathing has to do with holes poked in their chest, and no amount of CPR is going to matter. If you're in a different scenario where that's really not a thing that you have to worry about, we'll talk about that a little bit here anyways. These CPR masks are good. You put it on the victim, and then you're going to breathe through the one-way valve. That way if they puke, you're not getting that crap down inside your throat and into your own lungs. It's super disgusting. You don't want that. So if you're ever doing CPR, I'd carry, if you plan on doing that, I'd have a full-size one of these or a tiny pocket one, which is just a real flimsy one-way valve and a piece of plastic, again, to keep all of that, mostly vomit, from going inside your own mouth. We'll go over here on I got a slide with a demonstration. All right, we've got the side profile here of the airway. We've got the sinus cavity. We've got the oral cavity here, and then this red thing's the tongue. Here we can see that the tongue is blocking off the airway, and that is what we're trying to avoid, and that's the biggest problem. If we put them in a positional airway, like laying on their side, that's going to open up this airway because the tongue's going to fall forward. The nasal pharyngeal is going to come in through the nose, going straight back, and then curving down here, going just past this point where the tongue is falling on the airway, but not getting to this point over here where the gag reflex is at. That's why you can use the nasal pharyngeal when they're awake, versus the oral pharyngeal will come back and it usually extends back in and cause them to gag if they're conscious. So you don't want to use that then. You don't want to use that unless they're on the backboard. The contraindication or the reason why you wouldn't do something for a nasal pharyngeal airway is if there's trauma up here to the bone structure, because you could potentially be pushing that nasal pharyngeal airway into the brain housing unit, which is right there. But again, all we're really trying to do is maintain this opening here. Thanks for joining us today here at the Outpost. Hopefully you learned something. Remember, if you're ever dealing with anything you learned from a guy on the internet, contact your doctor and your lawyer and get it cleared with them before you try it. That way they're liable, not me. Big thing, airway. If you can talk to them, that's good. They can breathe. Try to keep that tongue off the back of the throat, especially when you're moving them around, because if they lose consciousness, choke, you're going to be doing a lot of extra work carrying somebody who's going to die than you need not do, because just don't kill them. Thanks for joining us. God bless. Have a good day.